Hi everyone, so I am Trina Hagan. So for today, I will be discussing to you the learners with special educational needs, which are the learners with difficulty hearing and learners with difficulty communicating focusing. So before I will start for my discussion, let's have first a motivation. So I have prepared a two pictures and incomplete words as a clue. And what you are all going to do is just fill the missing letter to form a complete words. Are you ready? So first clue. Yes, very good. It is difficulty hearing. Second clue. Yes, very good. It is the difficulty communicating focusing. Alright, let's start with our discussion now. Learners with difficulty hearing. Hearing impairment as a disability category is similar to the category of deafness, but it is not the same. So why they are not the same? Because deafness is defined as partial or complete hearing loss, while hearing impairment is mean the difficulty to hear clearly as much as the others normally do. So the official definition of a hearing impairment by the Individuals with Disabilities Education Act or IDEA is an impairment in hearing, whether permanent or fluctuating, or it either gets better or worse over time and stays the same over time. That adversely affects a child's educational performance but is not included under the definition of deafness. A hearing loss above 90 decibels is generally considered deafness, which means that a hearing loss below 90 decibels is classified as a hearing impairment. So hearing loss is generally described as slight, mild, moderate, severe, or profound, depending upon how well a person can hear the intensities or frequencies more strongly associated with speech. Impairment in hearing can occur in either both areas and may exist in only one ear or in both areas. Generally, only children whose hearing loss is greater than 90 decibels are considered deaf, and below 90 decibels is classified as a hearing impairment. An age of hearing impairment. Prelingual is the loss of hearing before speech and language developed or born deaf. Postlingual is loss of hearing after spontaneous speech and language has developed or loss of hearing. So causes of children's hearing loss or learners with difficulty hearing. 50% of all cases of congenital hearing loss in children are caused by genetic factors. An inherited hearing loss does not necessarily mean that one or both parents also are hard of hearing. In fact, about 90% of children with congenital hearing loss are born to hearing parents who may have passed on the condition by being carriers of recessive genes. Prenatal causes. Prenatal illness account for 5 to 10% of the cases of congenital hearing loss and include infections during pregnancy, such as rubella, cytomegalovirus, herpes, or syphilis. Toxin consumed by the mother during pregnancy or other conditioning occurring at the time of birth or shortly thereafter. Babies born prematurely, also have an increased risk of becoming hard of hearing. The use of drugs that cause hearing loss by the mother during pregnancy, known as ototoxic medication. These drugs are usually prescribed medications, includes antibiotics and some pain relievers. Ototoxic drugs potentially causes damage to the auditory nerve or other hearing structures in a fetus. Drug or alcohol abuse by the mother, or smoking during pregnancy. Perinatal or postnatal causes. After birth, to the head or childhood infections such as meningitis, chickenpox can cause permanent hearing loss. Certain medications such as antibiotic, streptomycin, and related drugs also can be the cause of the child's hearing problems. Ear infections like otitis media may cause temporary hearing loss or lead to a permanent hearing impairment if it's left untreated. Exposure to loud noise, one or causing noise-induced hearing loss. So untreated or frequent otitis media, air infectious, exposure to secondhand smoke or other toxins. Lastly is that 10 to 29% of hearing loss occurrences are due to postnatal causes. So there are 4 types of hearing loss. First is the conductive hearing loss, or a conductive hearing impairment result from a blockage or damage to the outer or middle ear structures. This problem interferes with the transmission sound through the outer and middle ear to the inner ear, resulting in reduced loudness of the sound or quantity of sound. A conductive hearing loss can fluctuate according to the presence or severity of the blockage. B. Sensorineural hearing loss. A sensorineural hearing loss results from damage to the inner ear or the auditory nerve. It can range from mild to profound and often affects the student's ability to hear certain frequencies more than others. Thus, even with amplification to increase the sound level, a student with sensorineural hearing loss may perceive distorted speech sounds, resulting in difficulty with understanding speech and interpreting various sounds, quantity, and quality of sounds. C. Mixed hearing loss. A mixed hearing loss refers to a combination of conductive and sensorineural hearing loss. It is indicating that there may be damage in the outer or middle ear and the cochlea or auditory nerve. Lastly is the D. Central auditory processing disorders. This form of hearing impairment occurs when the auditory centers of the brain are affected by injury, disease, tumor, heredity, birth trauma, head trauma, or accident causes. Although the outer, middle, and inner part of the ear deliver sound signals, these signals are unable to be processed and interpreted by the brain. Thus, even though the person's hearing may be normal, there are common difficulties with understanding what is being said, resulting in learning problems. So, learners who have difficulty hearing tends to speaking loudly, positioning ear toward the direction of the one speaking, asking for information to be repeated again and again, delayed development of speech, watching the face of the speaker intently, favoring one ear, not responding when called, has difficulty following directions, does not mind loud noises, and learning close to the source of sound. So there are assumptions that the only adjustment for hearing impaired students is to make all instructional materials and techniques in written format. These are other ways to hearing impaired. This is the other ways to adapt to hearing impaired students. Teachers should help students with difficulty hearing to use the residual hearing they may have. Teachers should help students develop the ability for speech, reading, or watching other lips, mouth, and expressions. Teachers should be mindful to free the class at all times when presenting information, while ensuring that the students with difficulty hearing sit near them. Exaggerating the pronunciation of words should not be done, for it just makes it difficult for the student with difficulty hearing. Direction as well as important parts of the lessons. It should always be written on the board. Written or pictorial direction instead of verbal directions may be given. Steps to an activity may be physically acted out instead of verbally given. A variety of multisensory activities should be given to allow the students to focus on their learning strengths. Lastly, the teachers should be more patient when waiting to hear our responses from a hearing impaired students, which may take longer than usual. Learners with difficulty communicating and focusing. It is described as a communication disorder such as stuttering, impaired articulation, a language impairment that adversely affects a child's education performance defined by the Individuals with Disability Education Act. In other words, children with communicating focusing difficulty have deficits in their ability to exchange information with others. So there are identification of learners with communication difficulty may have little or no speech, have difficulty saying or generating words or sentences, have difficulty understanding what other people are saying, have difficulty knowing how to interact socially with other people, find it hard to fully access learning opportunities at school. Types of communication impairment and disorder. First is a communication, speech, then language. Communication, speech, and language underpins everything that we do, from making ourselves heard and expressing our thoughts, ideas, opinions, or interacting with others and understanding what they are saying. Learning strategies and learning preferences of communication difficulty. Educators should create an environment of acceptance and understanding in the classroom and encourage peers to accept the student with speech impairment. Practice and maintain easy and effective communication skills by modeling good listening skills and by facilitating participation of all students in a classroom discussions and activities. Introduce new vocabulary carefully and model it frequently in sentences. Try to limit the amount of new vocabulary introduced at one time to a minimum and use visual support where possible. If a student requires a sign language interpreter or the use of augmentative communication, provide adequate space and time to accommodate this form of communication. Teachers should constantly model the correct production of sound, maintain eye contact with the student, then tell her to watch the movements of your mouth when providing direct instructions. Ask her to copy these movements when she produces the sound. Allowing more time for a student to complete activities, assignment, and tests. Having a student sit near you to easily meet her learning needs. Discussing possible areas of difficulty and working with the student to implement accommodations. Always asking before providing assistance and using positive reinforcements when the student completes an activity independently. Using peer assistance when appropriate, modifying activities or exercises so assignments can be completed by the student but providing the same or similar academic objectives. Creating tasks that are appropriate for the student with speech impairment, for example, written instead of oral or vice versa. Providing scribbles for tests, providing scribes for test taking if a student needs assistance. Last is making sure that the student understands test instructions. Lastly is to making sure that the student understands test instructions completely and providing additional assistance if needed. So in other words, we future educators or all the teachers should ensure that learners with difficulty communicating focusing are supported, assisted, and provided with their needs. That's all. Thank you. Bye.